Do you want more energy, a sharper memory, a better immunity, and easy weight loss? Hi, I am Dr. Moumita, general physician from Uni Health Clinic. Let me take you through a very important and powerful weapon that we have with us and we are not using it properly. That is sleep. Let's talk about sleep today and why and how it is impacting on our health. Sleep, it's very easy. You don't need to do anything. But nowadays, all of us are suffering from lack of sleep, difficulty in sleeping, waking up from the sleep, not getting enough sleep, and even after sleeping also, we are not feeling fresh. We are getting headache. Yes, some of the reason could be because of some health related issue, but most of the time it's something that we are making by ourselves. We are making our sleep habit wrong. So, what is sleep? So, sleep is a restful time. But remember, when we are sleeping, actually we are not resting. Actually, our body is not resting. Our brain is not resting. When we are sleeping, our brain is continuously working, our hormones are continuously working, our inflammatory markers are continuously working, our immunity is continuously working for a better and improving our health status. So when we are sleeping, the sleep usually has few cycles that is called REM, so rapid eye movement, and NREM sleep. So which will come as a cycle by cycle. Initially, whatever we sleep, so initially whenever we sleep, it goes from N1 or light sleep to the deeper sleep. So N1 usually lasts for 5 minutes to 10 minutes. N2 will last for 10 to 25 minutes. Then slowly it goes to deeper sleep. And deeper sleep is the important part when our body will release some kind of important hormone, that is growth hormone, which is important for recovery. Recovery not only for cellular repair, not only for whenever you are getting sick, you need your body, your cells to get repair. Whenever you are working out, you need your muscles to get repair. So for each and every recovery, we need growth hormone. So that usually comes in the deeper sleep. N2 is a period, it's the maximum period. Usually we will be in N2 most of the sleeping time. And after that, when we go for a deeper sleep, and then comes the REM. Usually REM sleep will be towards the later stage, towards the early morning. So people who are more alcoholic, so usually they will have REM sleep deprivement. What are the things that is impacting our sleep? If we see, now we know about sleep cycle. Now what are the things impacting our sleep? So sleep is not only about de-stressing ourselves. It has a hormonal impact, it has our nervous system impact, it has our psychological impact. So when we are coming down, our body and our brain will get rest. And there is one hormone called melatonin. When the melatonin secrete, our body goes to the sleeper cycle. So if we are continuously watching screen or any light, natural or anything artificial light, the melatonin won't come. So that's what is most of the common thing that is happening nowadays. We will be continuously seeing some scrolling down some kind of screen, maybe mobile, maybe laptop, maybe TV. So because of that reason, yeah, our body, our brain, our eyes are continuously working. So it won't go, the melatonin won't come, so it won't go for a resting period. Second thing, insulin. Whenever we are eating, our insulin is high. If our insulin is high, melatonin won't come. Melatonin to come in our body, our insulin has to be low. So if we are having our dinner around 11 o'clock and thinking that we'll get sleep by 11:30 or 12 o'clock, that is not going to happen. So these are all disrupting our sleep. Then comes coffee, alcohol. So those are all exciting things. Alcohol, initially that will make you sleep, but it disrupted the REM sleep. So you see many people who are alcoholic, they will get up early in the morning. And people who are taking caffeine, if they are taking around 6 to 8 hours after or 6 to 8 hours prior to the sleep. So that is what is disrupting our sleep cycle because it is exciting our nervous system. Exercise. If somebody is doing very high impact exercise within 2 hours before they are going to sleep, exercise also will increase the cortisol level. Because of that, they won't get sleep. So many of the people I know that especially who are doing in evening shift or night shift, they will go to gym and then they will come and they will try to sleep. They are not going to get sleep because their cortisol level is high. So let us fix those problems one by one.